This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
Thank you so much. And last but certainly not least, we have the University of Missouri. If you're on the call, you are free to take over.
Hello, we absolutely are. One of our guys is pulling up some slides right now. We'd like to start off by saying thanks to PM&R Scholars for organizing this event and doing a great job with that. And thanks to each of you for your interest. We certainly see some familiar faces in this group also. So we're at the University of Missouri in Columbia, Missouri, a great location to soak up pathology and things from all across the Midwest and really even around the world. We'll get into that. This evening, we've got myself, Ben Gill, Jake Traumatulo, Katomi Obayashi, Duncan Braultz, and I believe our program director, Dr. Claire Finkel, also made it on. We're going to have a brief presentation from Jake. Katomi and Duncan are ready in the chat, so please, throughout the presentation, you can drop your questions there and we'll reply in real time. In general, as a very welcoming program and resident group, you're welcome to always contact us. I'm always happy to take your phone call or send you back an email. Just reach out, and our contacts will be available at the end. Jake, take it away.
All right. Well, we're just going to work our way through a presentation here. So new leadership here with us. Our former program director, Dr. Joseph Burris, has moved on to become the program chair and is still around the program. And we have the very capable and awesome Dr. Claire Finkel, who has taken over as our program director, formerly our program director, and runs the traumatic brain injury program here. And then Dr. Brian Todebush, who's one of our sports MSK outpatient physicians. So we have a really nice blend of inpatient and outpatient leadership within our program. A pretty robust faculty, especially that you can see here, especially in consideration, we are a small to mid-sized program and we have more faculty members than we do residents. So you are pretty much exclusively working one-on-one with our faculty members at any given time, which is a great for our learning experience. Here's our current class of 2s, 3s, and 4s, just so you can put some faces to names and email addresses for everyone if you want to grab a quick screenshot so you can take a look and contact us at a later date. We really do have a tight-knit program, as you'll see with some pictures here later on, and it's been a blessing to work with each and every one of them. Kind of one of the things that I think is impressive about the program is we will pull from everywhere. There's no regional bias. We want the best and the brightest from everywhere. And I think the program's done a really good job of pulling people from coast to coast, the coldest of the north, the warmest of the south, and kind of a blend of ideas and training from across the country. And it's really been a boon for the program to bring these diverse thoughts in. And it's something that we've got a really good track record of doing. And I know we aim to continue to do so going forward. We have a number of training sites here. Rusk Rehabilitation Hospital is our primary hub and all of our inpatient training is done there. It's a freestanding facility in town. And then we have the University Hospital, our VA, and the Missouri Orthopedic Institute, which is primarily houses our outpatient spine, sport, MSK clinics. The university, the VA, the Orthopedic Institute are all in the primary Missouri University Hospital complex, about a 3-minute walk from each other and only 5 to 10 minutes away from Rusk. So a tight-knit downtown area makes everything very easily accessible. We have a very robust and pretty broad scope of training that we get here. Your first year will be largely inpatient, as we touch on in a sample schedule here, but kind of as your training goes along, you get more and more opportunities to experience the the outpatient side, the more niche side of medicine, and the specialty at large. I think one of the things that we've done very well here is procedure opportunities, and that's ranging from neurotoxin training to ultrasound guided injections with our musculoskeletal faculty, spine clinics, pain clinics. We have a ton of time that we get to spend with those trainings, and I think our procedural numbers, I would put our numbers up against anyone in the country, and we have ample opportunity for people who are interested in procedural practice to get the training that they need while they're at MIZZOU, and not even pursue fellowship. In some cases, we have a couple residents who we'll touch on in the future here, who have moved on and been able to kind of hit the ground running with procedural training, even though they didn't go through a fellowship. And I think one thing that we do really well is we do get a little bit of everything. And I feel like our training has been pretty fantastic with regards to catching a little bit of everything during our inpatient months or outpatient months. So we're exposed to everything that the field has to offer. Sample schedule, just so you can get an idea on what the general flow is. We are inpatient heavy in your PGY2 year, which gives you the opportunity to branch out and kind of see what the outpatient world kind of everything that PM&R has to offer after you get that good foundation under your belt and kind of the bread and butter that is inpatient rehab. We have a number of, I guess, discipline dependent teams on our inpatient unit, the stroke, the traumatic brain injury, the spinal cord injury, and just a broad spectrum of pathology that you get to experience when you're spending your inpatient months. I mean, I know that today we admitted someone who has metastatic cancer with Mets everywhere. You get cancer exposure. We have someone that we're expecting to come in the next couple of days with widespread full thickness burns. You get burn exposure. You'll get a little bit of everything. And I think I've been very happy with that type of exposure that we've gotten. Just an overview of some of our outpatient rotations and what you can expect. We have rotations where you're covering what you see on the inpatient side of things once they leave inpatient rehab and follow up a couple months later. We have a lot of musculoskeletal, spine, pain coverage. We have a couple months that we spend with a pediatric PM&R physician who's been fantastic. All the EMG exposure you could ever want. A really kind of broad and I think well-balanced curriculum. Just some finances, just so you guys know. I think financially, the program really takes care of us. Our salary is comparable to what you will see across the country. And when you factor in the cost of living of Columbia, Missouri, which is really quite cheap to live, I think my wife and I spend about $1,500 a month. That's getting us a 3-bedroom home, lots of space, updated kitchen, full backyard that's fenced in. It's a lot more than I think I ever anticipated having. Certainly in residency, we're very comfortable. We have everything that we could want. The program provides in the hospitals free meals, which goes a long way just for convenience factor, from saving money factor. It just kind of highlights how much that they're willing to take care of us and make sure that kind of basic needs are met for us. Research, I know it's been touched on in other ones. It is a ACGME requirement, and I think that the program is really putting effort into making this a robust program for us. We have a dedicated research staff, faculty members who are focused solely on research, who are doing their own thing, but at the same time helping us develop projects, reviewing our projects, helping us write abstracts to kind of put us in the best possible position to find research, to present it conferences nationwide. We get great support from our staff, both from providing opportunities for us, but also just supporting us going to places, covering flights and hotel rooms and conference fees so that we can chase kind of these opportunities that are going to prepare us the best that we can for fellowship or for our career going forward, and help us meet the people that we need to meet to have the best career that we possibly can have. We're a tight-knit group, and I think these slides and some of these slides coming up will highlight this. These are just some of our didactics. These are all spent. These are in-person, hands-on opportunities with ultrasound, with EMG. We love spending time with each other, and I think it's a great culture of a program. Just some extra educational opportunities. I think our MSK opportunities are phenomenal. We have ultrasound clinics. We have a like a pro bono clinic for the community that we spearhead the musculoskeletal side of things. We have high school coverage. We have MIZZOU wheelchair basketball team, which is one of the best teams in the country. We get to cover their games. The opportunities are very customizable, and this is one of the things that I've been happiest with the program with, is they will support us in what we want to do. Dr. Steve Lubert, who's one of our fourth-year residents right now, spearheaded this, and the program backed him 100%. But at this point in time, we're covering the university's recreational sports teams. At some point this year, I'll be covering a Quidditch game, which is not something I ever thought I would ever do, but a really unique, cool opportunity that I don't think most programs across the country have lined up like we have lined up. We have a prosthetics and orthotics conference that we do each year. We have a neuro PT fellowship, which welcomes us into their journal club, and we can work with hand in hand as much as you want. We have DO faculty members here. My group is getting off getting a program off where we do manipulation for staff members at the hospital, just to kind of hone our skills and give back to the staff that helps us each and every day. That was greenlit and welcomed by program leadership. They really do kind of want to make our education everything that we want it to be, and they're willing to work with us even if it's not an established program. So we've had a lot of success here with fellowships. This is the fellowship matches in the last 10 years or so. Everyone who has wanted a fellowship has gotten a fellowship. And I think we've done a really good job at placing people. And we have had residents go through Stanford. We've had residents go through Northwestern. We just had one of our residents starting his fellowship at the Cleveland Clinic. I think we are not only putting people in places, we're putting people in nationally recognized places. And I think it speaks to the education that we get and speaks to the ability that our residents have once they leave the program. And I think even those who don't want to go into fellowship, among our group who just graduated, 3 of them decided to go straight into the workforce, and they've all created what they want. We have people doing spine and ultrasound guided injections. We have people doing general PM&R amputee neurotoxin training who have kind of been able to not only find a job, but create the job they want in pre-existing systems, which speaks to kind of the quality of the training that we've gotten. About Columbia, really is a great place to live. We kind of touched on the cost of living, but not only that, it's a college town, it's a vibrant town. There is a lot going on within the community itself. You're nestled right in the central of Missouri, with Kansas City 2 hours in one direction, St. Louis 2 hours in one direction. There's everything that you could want nearby that you can do day trips for. I know my wife and I have done that plenty. I've been surprised at how much there's actually to do, and it's been a great place to be and live. Again, just some pictures. We spend a lot of time together. I know that we have a college football kickoff barbecue coming up for wellness. It's a group that really likes to spend time together. It's something that we very much emphasize in our process, is finding people who will work well together, who want to be together. And I think every program will tell you this, but I really do think the community that we have here is special. And it's a program that I wish everyone could hear about and learn about and get to see for themselves, because I think we do something special here. I want to open up and kind of have some opportunity for you guys to ask some questions. I know the chat's been going a little bit here. Here's some contact information if you want to take a screenshot. I know everyone on the screen has more volunteered their information. They're all happy to answer your questions at any point in time. I will turn it over to people just to see what the chat's been looking like. And if anyone has any questions, feel free to jump in now.
So we got a question about barbecue here in Columbia, but I will also say there's several vegan options around here, and not just barbecue heavy. Great food here. I've lived all over the world, and I've been very impressed how many options there are in this town to try different cuisines and, of all types of backgrounds. That being said, we've got a football party coming up in 2 weekends at Dr. Brawl's house, and I'm hoping we have some good barbecue there.
And there was a question in the chat about exposure early on in preparation for fellowships. And so we have some of our residents on that are currently interviewing for fellowships. So Dr. Gill, Dr. Obayashi, Dr. Braultz, Dr. Tramatullo, these are all residents that are fellowship minded. Dr. Gill, do you kind of maybe want to address how you approach that, since the second year is inpatient heavy?
Yeah, so I found I had plenty of time, especially in early PGY 3 year, to customize my schedule the way I needed it to. I applied for ACGME pain. My application went in at the very end of December, complete application at that point. I was able to say, yeah, I've done over 7 months of chronic pain rotations. I had procedure log that rivaled most fellows by the time they completed their training. And I found just across the board, it was pretty unique. I was shocked actually at first. And, with applicants from different types of specialty backgrounds, that was very abnormal. So really gave me a lot of opportunity, plenty of time for me to do a ton of research, applications, their support, as we saw, for society participation. All of those things really set me up well. And speaking for some of my other co-residents, we've got someone right now applying to sports medicine fellowship. So a little bit later in the PGY 3 year, going into PGY 4 years, when you submit that, again, in a fantastic position. And now he's kind of rounding out with even electives related to urgent care and other things that are very customizable.
5 minutes remaining.
Yeah, and I think the opportunity is even earlier. To echo that, like, I'm interested in doing sports medicine, and one of the outpatient rotations I got to do, even PGY 2 year, was working with our outpatient musculoskeletal team, and I had a ultrasound procedure log, which was out kind of greater than what the national average was within it was my December month of PGY 2 year. It already had all that exposure and all those opportunities, and you will get everything that you can want and handle early on. So those opportunities are there.
We have a quick question. Dr. Finkel can probably best answer regarding signal preferencing. How will that be viewed by your program this year? And that's certainly a new thing that will allow the program director to address.
Yeah, so that's all, it's new for all of us. So certainly, signal preferencing, allowing you all as applicants, I think, more autonomy and really expressing serious interest to programs that are some top choices for you. So I think that's a really good way to communicate to programs that you really do have genuine interest. And so I think we're all kind of excited to see how that works. I know it's worked favorably. I believe it was ophthalmology that piloted it first and rolled out to many more programs this year. I think I saw a next, oh great, Dr. Brault's doing an awesome job rocking the chat. So on particular pathologies that you get exposure to, we have a very strong amputee program at MIZZOU PM&R, and we're really proud of it. So Dr. Burris, our chair, has over the last few decades really grown that. And so on the inpatient side, getting more exposure than pretty much any other unit in the country, if you're looking at the numbers compared to regionally or state or nationally, both pre-prosthetic and then actually a unique program bringing patients back once they get their prosthetic limbs to work on gait training. So that means you as residents get to look at the microprocessor knee and the different feet, and really a strength and a neat thing with our program.
I believe there's a question about what research is considered in the review and application. I believe that pertains to applying to residency, maybe as what you're looking at inside of the resident application. Dr. Finkel, you want to speak about your experiences reviewing applications, some of the things that you go through?
Sure thing. So we really do look at the application holistically at MIZZOU. So reading through the application in its entirety. And so I wouldn't say there's one specific thing or a certain number of metrics that we're looking at in any application. It's the application as a whole and all the experiences that brought you to PM&R and to applying to our program. So that's maybe a little bit of a non-answer, but really looking at the applicant as a whole, which you spend so much time in your application expressing that for us. So we make sure that we read through it all and spend a good amount of time bringing the best applicants in.
And if I may help with that too, just one thing that was brought up earlier, I know when invites go out, those are serious invites and they're not inviting more people than they have spots for or anything along those lines. And Dr. Finkel again is agreeing with that. So Brandy does a great job. Our program coordinator organizes those things. And if you have any specific questions, I'm sure you can reach out and we'll get those addressed.
Yeah, I would like to give a shout out to our coordinator, Brandy, who is amazing, a really great coordinator. And yeah, and we don't offer more interview spots than we have. So if you're getting an interview invite, and we have a spot for you.
And I think we're sliding in just last minute. Do residents have children and families? Yes. Our last graduating class of 4 residents all had children within the last year before graduating. They all had at least one child. One was leaving with a couple children. I've got 2 boys that I raised too, and families too. Yeah, my wife has a doctoral level NP. She teaches at 2 faculty, or she's faculty at 2 different nursing programs. We're busy, you know, it's great. But it's very doable here in Columbia. And if you want to talk more about that, we're certainly willing to share and talk more. Well, Belle, thanks again for organizing. I think we're the last program to wrap up this evening. Once again, here's all of our contact information. Please reach out. Again, if you have a brief question or if you want to chat for a little bit, some of you guys, especially coming from KCU and other places, I've talked to you. We're willing to just chat on the phone in between, you know, driving places, whatever it takes. Reach out and we'll tell you more.
Thank you so much, the University of Missouri.